अस्सलाम वालेकुम, मैं डॉक्टर मुफीद बट आज जो टेक्निक मैं आपको दिखाने जा रहा हूँ वो टीसा है। ये उन लोगों के लिए एडवाइजेबल है जो एज़ोस्पर्मिक होते हैं, जिनमें स्पर्म बिल्कुल नहीं होते। इनमें एक सर्जरी होती है जिसको टीसा बोला जाता है, जो यूजुअली हम स्पर्म्स टेस्टिस से ही निकालते हैं। ये जो फ्लूइड होता है हेपेटाइटिस में, उससे निकालते हैं। ये एक सिंपल प्रोसीजर है। इसको हम लोकल एनेस्थीसिया भी कर सकते हैं, एंडोजनल एनेस्थीसिया भी कर सकते हैं, डिपेंड्स अपॉन द चॉइस ऑफ द पेशेंट। एंड इसको करने में ऑलमोस्ट 5 से 10 मिनट लगते हैं। दिस इज द बेस्ट प्रोसीजर दैट कैन बी एडवाइज्ड टू अ पेशेंट हु इज एज़ोस्पर्मिक। सो लेट मी शो यू हाउ इट इज डन, एंड इट इज अ पेनलेस प्रोसीजर. You can see it in this video. This is putting an anesthesia into the cup. So let me show you how it is done. The second step is that we give a local anesthesia over the testes. So it is subcutaneous. So we have to hold the testes, we have to push it and see. We'll put needle through it and it will be painless. So now I will show you another testes. So thank you. This is the third step. We put this suction needle in and we try to get some tissue out of the testes from its upper, middle and lower lobes. Then we see where from the sample can come and we can check that under a microscope to see, look for the sperms. You can see the seminiferous tubules in it coming. So we will take the sample under microscope and we'll look for the sperms. Putting it under the media. Now we can see just after 5 minutes after TESA, patient ready है चलने के लिए। तो आप उठिए प्लीज़, आप चलें। और ये बिल्कुल एक नॉर्मल प्रोसीजर है। Patient can walk normally without having any problem, and after 5 minutes, the patient can go home. So this is a very simple procedure. सब आप इससे दिखाने की कोशिश कर रहे हैं ताकि हम वो डर निकाल दें लोगों के जहन में जो है कि टीसा बहुत बड़ा प्रोसीजर है और इसको करने में हमें बहुत दिक्कत होगी और इसके बाद पोस्ट टीसा बहुत दिन तक रेस्ट करना चाहिए। नहीं, ऐसा कुछ नहीं है। इट्स अ सिंपल प्रोसीजर। पेशेंट को आधे घंटे में विल बी परफेक्टली ऑलराइट।
Once we receive the tissue from the theater, we will have human tubal fluid with us. What we do is we take some amount of the human tubal fluid in the center of the dish. Very clean. Then, with the help of tuberculin series, we shift this tissue into the fresh human tubal fluid. So this is where the tissue is now. So leaving behind the fluid which came from the OT and also some blood clots. So we discard this, we don't need this. This is the fresh media with all the tubules, the seminiferous tubules. We bend the needle and what we do is we hold the tissue with one needle and stretch with the other one. So this technique is called milking. It breaks the tissue. It also squeezes the tissue so that the sperms come out of the tubules. And make sure we crush the tissue completely so that all the sperms come out of this. There are only few motile sperms and they are just twitching sperm. So now I'm going to add this sperm activator. It's pentoxifylline, which will actually activate the sperm. So I'm going to add to this sample few drops of pentoxifylline. Soon after adding pentoxifylline, it has activated the sperms. Now I will pick these sperms one by one. Morphologically normal sperms, I'll pick them. The challenge would be a lot of debris around. There are RBCs, there are spermatogonia cells, and there are other connective tissue cells. So which tends to block my needle and my needle will get sticky. I might use a couple of injecting needles to pick these sperms and finally a fresh needle to inject the oocytes. So let's start here. Now, after picking sperms from the sample, we have to shift it to the PVP. So we separate them for injection. We are in hunting phase where we collect the sperms. Once we are done with the desired number, then after that we'll go for immobilization of these sperms. So all the sperms which are collected in the needle will be released again here in PVP. It's a thick fluid where they hardly move. They find it difficult to move and easy for us to manipulate and catch them here and do morphological assessment. We will allow the sperm to swim for some time so that they change their place, so which is auto cleaning of the sperm. This is the one we have taken, and the second one, this is the second one. We are again taking it back in the needle from a distant place, not exactly the same place where we have left them. So we allow them to swim some distance, so that is auto washing. So earlier sperms we left here, we will leave these sperms also here with them, with the same group. You can see the previously caught sperms, and we will leave these sperms also along with them. They will find it difficult to move there because it's again thick fluid, PVP, we call it as PVP. Difficult for sperms to move faster. Since it is unprocessed sperm, so their stickiness is more. So we should leave them apart, not close to each other. Otherwise, they'll stick to each other. After selecting the sperms for injection, now we are taking out the oocytes from the culture for injection. We're taking only half of the oocytes. Inject those oocytes first. Then again take the next set of oocytes to avoid exposure. Finally, we are done with this. We have injected all the oocytes. After XC, we culture these oocytes in calcium ionophore, which actually artificially activates the egg, because sometimes these sperms, they fail to activate the egg for fertilization. So we expose them to the activator to increase the chances of fertilization. These kind of cases are really challenging for embryologists because picking the sperm from the debris, then selecting the morphologically best sperm and injecting But when such cases succeed, it gives the real thrill. This is where we work behind the scenes from Valley Fertility Center.